Hi, I'm Dr. Bannock. I see a lot of patients who have poor posture and they hunch a lot, they're at their desk, they're typing, and so they have a lot of neck pain and back pain, and so I wanted to do a little demonstration of a stretch that I give my patients as homework to do. So I'm going to show on Dominique here, and just to give you an example of how the front part of your neck is so important. It's called fascia here, anterior cervical fascia, and if you pull really hard on your dress or your clothes, it's going to pull this way, which is then going to affect all of the tissues in the back of the head and neck and up into here. And so people who have TMJ or jaw pain, that's another contributor if all of this is tight. So I'm going to pull down here, and then Dominique is going to lift the shoulder. And how challenging is that? It's difficult compared to the other side. Very easily done, right? So this is just an example of how fascia can pull. So you're thinking your pain is coming from the back of your head or your neck, and it's really coming from the front. So we're going to do a little example. So this collarbone area right here, you're going to have your fingers right underneath it. So I'm going to do it with Dominique. So fingers right underneath here, and then you're going to look up. And so if you can see, she can't look up very far. If we don't hold this at all, not look up. So she can look up pretty far, but this you're going to hold down a little bit and then look up until you feel this stretching right through here. And then you're going to take your head to the side, and all of this is stretching, and then take your head to the other side. And you can do this 1 or 2 deep breaths in each position, and then come back to the center. And if you look up again and try to swallow, see, it's kind of difficult when you do that. And that's an example of how all of the fascia that surrounds our tissues is affecting our internal organs as well. And so this is a stretch that you're going to do every day. You can kind of take your hands out to the side and do the same thing, and look up, and then over to the side, out to the other side, and back to the center. And you can kind of work your way down your chest. Another one you can do is kind of shrug your shoulders up. You're going to come over your collarbone, kind of get your fingers in there, and then bring your shoulders down, and then look up again. And that's a different kind of stretch. And then over to the side, and to the other side. So here she's starting to get lifting her shoulders up. In order to get that side motion, you want to stretch until you feel a stretch. So you're going to go to the side a little bit, and right where you start to feel the pull, that's where you're going to stop. So I actually started to feel the pull right through there. Yeah? So you're not going to go past your limit where you're using other muscles to get that stretch. You just want to go to the point where you feel a little bit of a stretch, and then come back to the center. And then good time to do this would be in the shower, because that helps loosen up your muscles and your fascia. And if you shower every day, that's something you can incorporate into your daily routine. This didn't happen overnight, and so this doesn't happen overnight either. And that's why we want this to be something you do on a daily basis.
Okay.
Any other questions?
I'm okay.
All right.
That was pretty clear.
Good. Thank you.